Are you overwhelmed with even thinking about the Medicare annual enrollment period? Well, it's open and it's time to get ready because there is an easier way, and it's important that you shop for a plan because there's some super cool changes coming in 2021, and most likely there's a better plan out there, probably at a way more affordable price. So let's get started. We're going to start in section 1. First of all, Medicare annual enrollment is open from October 15th to December 7th. You've probably seen way too many commercials, and you probably know those dates by heart at this point, but I just want to mention it. In section 1, has your health changed in the last year? Is there anything, did you have a new diagnosis of something that you have to address that is going to come up in 2021? The plan you had last year may have been fine, or actually this year may have been fine, but that doesn't mean it's going to work for you next year. Has anything else changed in your health or your lifestyle? Maybe you've started a new habit that you want to break in 2021, or you started a new healthy habit that you want to continue. So you started going to the gym. You didn't do that before 2020, but now you want to keep it up. Well, there's plans, Medicare Advantage plans that include gyms, yoga, swimming, super cool stuff. And there are thousands of plans, some of which cost $0 a month. So write down anything that's changed with your health or your lifestyle. Let's go to section 2. Review your annual notice of change. Everyone on Medicare should get a notice of their annual notice of change. And you want to make sure that you read this and write down a couple things. First, have benefits been added to your plan? Have benefits been removed from your plan? Are there any changes to providers in your network? Are there changes in your in or out of network coverage? And have there been changes to your prescription drug coverage? It's important to understand how the plan has changed so you understand how that's going to affect you for your plan next year. So let's go to section 3. Coverage benefits. Does my Medicare plan cover my current health needs? Maybe it does. Maybe not much has changed. You're pretty healthy. You don't go to the doctor. You're fine. Still important to understand if there's new benefits or if there's any benefits that you have lost in your current plan. Will any of the plan's changes in the upcoming year impact my healthcare needs? Based on those changes, is that a problem or is everything okay? Maybe some of the benefits that were removed didn't really impact you and you don't need them. Are my preferred doctors part of my plan? Very important. Just because your doctors were part of your plan last year or in 2020 doesn't mean that they're automatically included in 2021. So you want to make sure that your non-negotiable doctors, the ones that you have to have in your life, are still covered under your current plan. Are there any prescription drugs that I need on my plan's formulary? Yes or no? Section 3 continued. Can I get my drug prescriptions online or via mail? There are super cool coverages, like you can have your prescription drugs dropped off at your front door. Seemed kind of fancy pre-2020, but now super common and something that you may want to consider. Do I want or need coverage for additional home services or items like dental or vision? A question I hear all the time. Does Medicare cover dental? Does Medicare cover dentures? Does Medicare cover glasses? Medicare does not care if you can hear, see, or chew, unless it is a disease that has diagnosed you with that problem. Just because we're aging and we need reading glasses, that typically isn't covered by your original Medicare Part A or Part B. But there are thousands of Advantage plans or supplement plans that do cover those benefits like it's no problem. If yes, these are important to you. Can I get it with my current plan? Maybe your current plan covers dental and vision. Are there rewards offered? So there's these super cool things that insurance companies are starting to do where they care about preventative and they're starting to reward you for behavior like going to the gym. If we were healthier and needed less drugs and needed less doctors, then can you imagine how much money the health insurance company would save? So it's in their best interest to keep you healthy and have you active and going to the gym. So there are reward programs, there are benefits like going to the gym and gym memberships. Let's talk about the fun stuff. Costs and finances. Have your finances changed in the last year? Something could have happened where you won the lottery or you spent all your lottery winnings and your financial situation has changed. So look at how much your plan's costing and the benefit that that's giving you. Like I mentioned, there are $0 plans available for Medicare Advantage. So you might be able to find a plan that actually has better benefits for little or nothing. Do your monthly plan premiums fit within your budget? Depending on how long you worked and how much you paid into the Medicare system or how much income you made, your monthly Medicare premium that's provided by the government, Part A and Part B, in many cases is not free. So if you're getting a supplemental plan or an advantage plan to fill in the gaps or Medigap, then there's probably a monthly premium with some of those. Especially there's high deductible plans and all of these, there's so many. It goes all the way up to N. That's how many there are. So is it fitting within your monthly budget? The plan you have now, you can try and stay around that if that's doable. But there may be a way better plan at an affordable price. Can you pay your plan's deductibles and co-pays and insurance and co-insurance amounts? You won't know this until you compare plans and you ask them, what's my deductible? What's my copay? Does my deductible hit first or is it throughout the year? Like all of these questions affect when you actually have to pay that out. Are my overall out-of-pocket costs what I expect them to be? There are certain things that we just can't budget for. We don't know if we're going to go in the hospital. We don't know if the doctor is going to charge us for excess charges. And sometimes, even if we ask, we don't get that information ahead of time. It's always coming in the mail as a bill that's a surprise. And it's a surprise that no one wants. So can I afford the out-of-pocket expenses that I may have to incur through the year? And do I need help paying for Medicare? There is extra help that is solely income-based that you could potentially qualify for. And that's absolutely fine. It's there as a resource for you to use. But do I need extra help to cover my costs? Now, the fun part is convenience and service. Can I easily contact my plan provider for questions? Most insurance companies have 800 numbers, have customer service that you can get to many hours of the day. I remember when there were a lot of companies had 24/7 customer service, but not all companies are like that now. But are they accessible? Can you reach them? Does my plan have online information or resources I can use? There are some really cool things that some of these insurance companies are doing. They're giving you an access to nutritionists. They're doing telemedicine. They're doing personal trainers. All of these things that help you have a better physical and mental well-being in your life so you can live a long, healthy life. And does my plan offer tools and services like a 24-hour nurse hotline? You know, the scary thing about the internet is you can Google the symptoms of a common cold and realize that you're destined for doomsday. It's there's so much information that you could easily be scared to death because of a common cold. So maybe a 24-hour nurse line is something that's important to you. And I just want to end by saying, yes, this process can be frustrating and stressful, and I get it. And every year it would be frustrating for my mom and I to go through, but it was so important. This isn't like changing your telephone company and going through the hassle of sitting on the phone with customer service for 5 hours while they find your account and cancel your account and do all these things. This is your health. This is your well-being. So if we can make the process easier by giving you these resources in one place, and you just taking the time to go through and organize everything, organize your thoughts, collect your thoughts, then you can go shop for the best plan for you at an affordable price. And I just want to say that when you are calling an insurance company directly, their goal is to fit you into one plan. That's fine. They might have the perfect plan for you. But as an informed consumer, your goal is to find the best plan for you at the best price possible. So consider going to a broker that's a licensed agent in multiple carriers or insurance companies. There are brokers that specialize in Medicare, that have people that are trained in Medicare, that have 30 different companies that they have plans for. That now just widens your options from 30 plans to 300. And now their goal is to find the right plan for you, not to fit you in a plan that may be okay. It's important. You've worked hard. You deserve the best health care possible. So take the time, go through the process, and have everything together so you can confidently call with as much knowledge and as much information as you need to say, this is what's important to me. This is what I'm looking for. What are my options? If you have any questions whatsoever, my website is realtalkmedicare.com. We have training. We just did a series with a dear friend of mine, Denise Anderson, and she is an accredited Medicare supplement advisor. And she goes through 400 hours of training a year to keep her accreditation up. And training is filled with information. We had tons of questions that were great. And this is one of many checklists that we have. So if this was useful to you, visit my website and you can get all the free checklists, no email required, and you can make this process much, much more simple. Thank you so much. Let me know if you have any questions. Take care.